Hi everyone, Jason Malcom, the social worker for the Parkinson Center of Oregon. If you've been to one of our symposiums before, you know that we have a regular feature there called Ask the Doc. And we have many great questions, but unfortunately the day of the event we're only able to get to a fraction of them. So we've decided to bring Ask the Doc to our Parkinson Center of Oregon Facebook page as a regular feature, and we will have different clinicians and doctors rotating in for this feature, and we're very excited to bring this to our Facebook page so we can answer your questions, because your questions are important to us. So with that, the first doc we have is Dr. Jeff Kraakevik, Assistant Professor, Neurologist here at Parkinson Center of Oregon. But first, I would like to say a disclaimer, and I do have to read this. So our first legal disclaimer. As with all the information on this site, the information presented here should not be taken as personal medical advice, as everyone's care is affected by multiple and individual factors. We recommend any changes you may make be discussed with your personal physician. So going along with the theme of our last, most recent symposium, so Dr. Kraakevik, any comments regarding listening to the radio while driving?
So I'm not aware of any studies out there looking specifically at listening to the radio in people with Parkinson's disease and how it affects our driving. However, as Dr. Uch shared in his presentation, part of what they did was look at when people were driving, they would have a CD going, and the CD would be giving math problems. So you'd have to go, 53 minus 26, and then they'd have to say the answer out loud, and then they'd have, 12 times 4, and they'd have to say the answer out loud. While driving, and the car they're in again is instrumented. So there's video cameras looking at the person who's driving. There's cameras looking at how far they are in the lane. They're looking at how fast the car is going, and whether the accelerator is pushed or the brake is pushed, and which way the wheel is being turned. And what they found was that as people were doing these mental math tasks, they had more lane violations. In other words, they went over that white line on the right side of the road, or the middle side of the road, the yellow line in the middle side of the road, more frequently if they were doing these mental tasks.
While the CD was playing.
Yeah, so again, it doesn't correlate completely with the radio, because listening to the radio is a little more passive than that, but obviously there are some things that you can listen to on the radio that can get you very mentally engaged, and so I would advise using common sense, and especially if in inclement weather or places where you need to be more attentive to your driving tests.
Maybe if they're unfamiliar with an area.
Correct.
Yeah.
It may be good to flip off the radio at that time.
Okay, great, thank you. Just a follow-up question. So do you know of a simulator here in Portland that people could use around here to help simulate their driving under conditions of listening to a radio, for example, or otherwise?
So Dr. Uch did talk about a driving simulator that he has, and he's from the University of Iowa. They have actually it's a Saturn. I know they don't make them anymore, but back when he set up a simulator, they did. The Saturn is in the basement, actually, of the University of Iowa, and it's instrumented again. It has a whole bunch of big screens in front of the car and behind the car. So they have projectors going, so it's kind of you get sort of a 3D environment set up, so they can set up all sorts of various scenarios to test the driver's reactions and ability to make wise decisions. Mm-hmm. That right now is just being used as in research purposes. It's not being used for clinical purposes. Here in Portland, I'm not aware of a driving simulator, but we do have various groups that will use rehab, or we use rehab groups that will assess how well a person's able to drive. So there's a group in Vancouver I've used, a group in Scappoose, usually composed of occupational therapists. They do a series of tests. Some of them even do an over-the-road test. Most of them, it's much more extensive than what you would get at the DMV, or I guess DOT. I'm in Iowa, and it's DMV in Iowa, DOT here. So at the end of that, you get a nice big report that says, if you're not safe, these are the areas, specific areas that we're concerned about. Or if you are safe, it says that we think this person is safe to drive. You get the report, it comes back to you and to your physician, and you can have an informed discussion about whether to resume driving and driving safety in general.
Okay. Thank you, Dr. Kraakevik. Thanks everyone for joining us for our first Ask the Doc on video for PCO's Facebook page. Please keep visiting our Facebook page for further Ask the Doc questions. And as always, this is a public site, so any information you post on here will be able to be viewed by anybody. So don't put any private information that you don't wish others to see on the site. But please post comments, questions, further questions that you want us to maybe address in the future. And please know questions of, that are more of an emergency in nature. If you're having an emergency, please dial 911 or go to your local hospital. And please keep posting and keep visiting our site. Thank you.